Today I'd like to discuss pharmacology, and one of the first things that we have to talk about with pharmacology is the actual naming of drugs. There are more than 2,400 drugs that can be prescribed by licensed practitioners. We have the chemical name, the generic name, and the trade name. So for example, the chemical name for Xanax is 8-chloro-1-methyl-6-phenyl-4-hydrogen S-triazolobenzodiazepine. Then we have the generic name, alprazolam, and then of course we have the brand name or trade name, Xanax. And of course the FDA is going to monitor what medications can make it to market in the United States. Now, other countries may not have as strict guidelines as what we have. Regarding medications, we have different classes of medications. Some are over-the-counter. Okay, they're called non-prescription drugs. Okay, examples of these include analgesics such as aspirin or acetaminophen, antihistamines such as chlorotrimazole and Dramamine, some sleeping aids such as doxylamine and melatonin. Okay. These are some of our definitions. Analgesic. Algese is sensation of pain, substance that produces a reduction in the sensation of pain. Antihistamine, hist is derived from histidine, and then amine is a nitrogen compound. It's a drug used to treat allergic symptoms because of its action that's antagonistic to histamine. Histamine is a compound liberated in tissue as a result of injury or allergic response. Okay, drug is an Old English term that means drug, a therapeutic agent or an addictive substance. Formulary, formule means form, and it's an official list of drugs approved for use in a hospital by a group of physicians. Generic, gener means birth, a non-proprietary name for a drug. Medication, medic means physician. Ation means healing, a substance having curative properties. Pharmacist, pharmac means drug. Okay, a pharmacist would be a person's licensed by the state to prepare and dispense drugs. A pharmacy is a facility licensed to prepare and dispense drugs. Pharmacology, science of the preparation, use, and effects of drugs. Pharmacologist, okay, a medical specialist in pharmacology. Prescribe and prescription. Prescribe is to write, script is writing. So prescribe is to give medications in writing for the preparation and administration of a remedy. And then prescription is a written direction for the preparation and administration of a remedy. Are routes that we use to get medication into the system. Okay, enteral route. Okay, the enteral route. Whoops. That means through the gastrointestinal system. Entero literally means small intestine. Okay, oral is the most frequently used enteral way to get medication into the system. We can also use sublingual routes. Sublingual means below the tongue. Linguo means tongue. Buccal, bucco means cheek. The buccal region and the area below the tongue are richly vascular, and so those medications get into the system very quickly. Nitroglycerin is a common medication. It's given sublingually. It gets into the system very quickly and causes smooth muscle dilation, which in turn allows the blood vessels surrounding the heart, the coronary arteries, to open up wide and restore blood flow to the myocardium itself. There's also rectal administration of medication, suppositories or enemas. Antiemetics are one class of drugs which are given rectally. These are abbreviations that are commonly used with medications. AC is before meals. BID is twice per day. GI, gastrointestinal. IV, intravenous injection. ON, at night. PC, after meals. PO, by mouth. PR, by rectum. PRN, when necessary. QD, every day. QID, 4 times each day. RX, prescribe. STAT means immediately. TID would be 3 times per day. We also have topical medications. Topical medications, of course, are going to be put on the skin. Steroid medications for treating dermatitis, as it mentions. Hydrocortisone medications that you might put on an itch, something that bits you and it's itching. Antiemetic, a medication that helps control nausea and vomiting. Eme is to vomit, so antiemetic would be to prevent vomiting. Bioavailability, bio means life. Available is to be worth, so the amount of a drug that reaches the systemic circulation and is available to reach the intended site of action. Buccal, buck means cheek, so inside the cheek is site for the administration of certain medications. Enema, Greek for injection, an injection of fluid in the rectum. Enteral means administration of medications by the GI tract. Enter means intestine. Formulation, formule again means form. The form in which a drug is presented, a tablet, a capsule, a liquid. Oral, pertaining to the mouth. Oro means mouth. Parenteral, administration of medication by any means other than the GI tract. Pessary is Greek for an oval stone, an appliance inserted into the vagina. Okay, that might be a birth control device or something along those lines, or it could even be a suppository that might dissolve in the vagina. Whoops. Pharmacodynamics. Pharmaco means drugs. Dynam means force. The uptake and action of drugs at their tissue sites of action. Pharmacokinetics. The movement of drugs within the body affecting absorption, distribution, metabolism, and excretion. Kinetic means moving. Rectal, rect means rectum, pertaining to the rectum. Sublingual, underneath the tongue. Linguo means tongue. Suppository, Latin, placed underneath, a small solid body containing medication that's placed in a body orifice other than the mouth to release the medication. Topical means medication applied to a local area. Topic means local. Toxin, toxicity, toxicology. Tox means poison. Toxic means poison. But toxin is poisonous substance formed by a cell or organism. Toxicity, the state of being poisonous. Toxicology, the science of poisons, including their source, chemistry, actions, and antidotes. Transdermal, dermo means skin, going across or through the skin. Trans is a prefix that means across. Self-administration of medications. Adverse drug reactions, that is something which is an unexpected side effect of a medication. Oftentimes people say side effects, but a side effect doesn't necessarily have to be a detrimental issue. It could actually be a benefit. Okay, for example, Years ago, when they were testing Viagra, it turned out a side effect was that it increased blood flow to the penis, causing an erection. Originally, it was being tested as an anti-anginal medication, but that turned out to be a side effect, and that's how the medication is marketed to this day. But an adverse drug reaction is something which occurs and is detrimental. Adverse, verse means turned, noxious, unintended, or undesired. Impairment, diminishing of normal function. Impair means to worsen. Interaction, action is to do, the action between two entities to produce or prevent an effect. Reaction, the response of a living tissue or organism to a stimulus. Synergist, synergism, synergistic. Erg means to work. So synergist, an agent or process that aids the actions of another. Synergism is coordinated action of two or more agents or processes so that the combined action is greater than each acting separately. Tranquilizer. Tranquil means to calm or serene. Izer is a suffix that affects in a particular way, an agent that calms without sedating or depressing. Now, in healthcare, before medication is given by a caregiver, they have to go over the 5 rights. And those include the right patient. Okay, so that's where you have to get into verifying with 2 forms of ID, the right medication, check the medication record for the name of the drug, and compare the drug in hand at 3 points: when taking hold of the package that contains the drug, when opening the package, when returning the package to storage. The right route, you want to make sure it's administered correctly. The right dosage, you want to make sure you have the right amount of medication. The right time that the medication is supposed to be given. You also want to have the right documentation as well. Here we have a patient who is self-administering insulin. Some 19 million Americans have been diagnosed with diabetes. 5 million of them self-administer insulin into their subcutaneous tissue, either by syringe or pen injection, high pressure jet injection, or subcutaneous infusion pumps. There's also an inhalation solution of insulin. Okay. Here's our vocabulary associated with our medications. Cognitive, pertaining to the process of acquiring knowledge. Aid is Latin to help, an official, confidential assistant. Cognitive, pertaining to the process of acquiring knowledge. Cognate means acquire knowledge. Capsule is a box, a solid dosage form in which a drug is enclosed in a hard or soft shell. Docu means to teach, to provide written proof. Documentation, the process of providing written proof. Dose is Greek for giving, the quantity of a drug to be taken at one time. Syringe is Greek for pipe or tube, an instrument used for injecting or withdrawing fluids. Tablet is Latin for small table. Now we're going to get into medications for specific problems, and the first one are allergy drugs. Corticosteroids are a safe and effective treatment for both allergic and non-allergic rhinitis in adults and children. 8 preparations are on the market in the United States, each differing in chemistry, delivery device, propellant, potency, and dosing frequency. They include, and I'm just going to go through these, Qvar and Becanase. I'm not going to go through the generics. Rhinocort. Fluticasone is a very common one, so Flonase and Flovent. Nasonex, Asmacort, and a combination of budesonide and formoterol, which is Symbicort. Okay. Antihistamines inhibit the effects of histamine at specific cell receptors. They have a number of clinical indications, including allergic conditions, for example, rhinitis, dermatosis, atopic dermatitis, contact dermatitis, allergic conjunctivitis, hypersensitivity reactions to drugs, mild transfusion reactions, and urticaria, which are hives, chronic idiopathic urticaria, motion sickness, vertigo, and insomnia. The first antihistamine to be developed readily crossed the blood-brain barrier, where they could cause adverse central nervous system effects, including sedation, drowsiness, and decreased cognitive processing. More recently developed antihistamines have a higher specificity for binding to histamine receptors, thus they do not penetrate the blood-brain barrier well and are less likely to cause the adverse effects of the earlier antihistamines. Antihistamines currently being developed by drug companies are intended to be natural metabolites of first-generation drugs, so they're designed to improve clinical efficacy and minimize side effects. Many antihistamine drugs are available without a prescription. Examples include early antihistamines like Dimetapp, Dimetane, Nasahist, chlortrimeton, Allerhist, Tavist, Benadryl, which obviously diphenhydramine often seen to accommodate a medication like Tylenol PM has acetaminophen and diphenhydramine. Newer over-the-counter antihistamines, loratadine or Claritin, doesn't cause drowsiness. Most recent prescription antihistamines include Zyrtec, Clarinex, Allegra, and Xyzal. There are several over-the-counter antihistamines. Astellin are available over-the-counter. Okay. Our terminology, allergy is work. So allergy is a state of hypersensitivity. Allergic is pertaining to allergy. Corticosteroid, cortico means cortex or cortisone, a hormone produced by the adrenal cortex. Histamine, hist is derived from histidine, and amine again is a nitrogen compound. We discussed this earlier, a compound liberated in tissues as a result of injury or allergic response. Antihistamine is a drug used to treat allergic symptoms because of its action antagonistic to histamine. Insomnio, somno means sleep, so insomnia is an inability to sleep. Vertigo comes from the Latin term dizziness, sensation of spinning or whirling. Cardiovascular drugs, okay, many classes of drugs in this area. Beta blockers diminish the effects of epinephrine and other stress hormones. All beta blockers are approved for the treatment of hypertension. Specific beta blockers are approved for the treatment of angina, atrial arrhythmias, coronary artery disease, heart failure, hypertension, and early post-traumatic stress disorder. Okay, these are some key abbreviations. ACE, angiotensin converting enzyme. ARB, angiotensin receptor blocker. AV, atrioventricular. CCB, calcium channel blocker. DERP, Drug Effectiveness Review Project. FDA, Food and Drug Administration. TPA, tissue plasminogen activator. Okay, that's a clot-breaking agent. Diuretics indirectly affect the heart by acting on the kidneys to stimulate urinary fluid loss, thus lessening the amount of fluid the heart must pump each time it contracts. Chlorothiazide, diuryl, furosemide, Lasix, and spironolactone, aldactone are examples of diuretics. Beta blockers are sometimes used in the prevention of migraines. There are some 20 different beta blocking agents altogether, including propranolol, Inderal, atenolol, tenormin, metoprolol, Lopressor, pinoldolol, Viscan, labetalol, Normidine, and carvedilol, Coreg. The renin-angiotensin system is a complex biological system between the heart, brain, blood vessels, and kidney. It plays an important role in the pathology of hypertension, cardiovascular disease, chronic kidney disease, and diabetic nephropathy. The potent chemical angiotensin II is formed into the blood form angiotensin 1 by the angiotensin converting enzyme, ACE. Angiotensin 2 causes blood vessels to contract and narrow, leading to hypertension. ACE inhibitors inhibit or slow the activity of the angiotensin converting enzyme. This action decreases the formation of angiotensin 2, so blood vessels dilate more and blood pressure falls. Some 10 different ACE inhibitors have been approved to control hypertension, treat heart failure, prevent strokes, and improve survival rates after heart attacks. Angiotensin receptor blockers, ARBs, block the interaction between angiotensin and angiotensin receptors on the muscles in the wall of the blood vessels, allowing blood vessels to dilate. They're used when patients are unable to tolerate ACE inhibitors because of persistent cough or, more rarely, angioedema. Calcium channel blockers, CCBs, inhibit the flow of calcium through channels in cardiac muscle and the muscles of the walls of blood vessels. This leads to a decrease in muscle contraction and dilation of the blood vessels. More than 20 calcium channel blockers have been approved to treat hypertension, particularly in elderly patients, angina, arrhythmias, and Raynaud's syndrome. A high mortality rate has been reported among people who take the drugs over an extended dosage period. Statins. Statins are a class of drugs that block the enzyme in the liver that's responsible for making cholesterol, an essential component in all cell membranes that's necessary for the production of bile acids, steroid hormones, and vitamin D. However, the body's production of cholesterol also contributes to the development of atherosclerosis. 7 statins are approved by the FDA for use. They vary in their potency to decrease cholesterol levels. Examples include atorvastatin, which is Lipitor, lovastatin, which is Mevacor, rosuvastatin, which is Crestor, simvastatin, which is Zocor, and pravastatin, which is Pravachol. One new drug, omega-3 acid esters, Loveza, lowers very high triglyceride levels. Okay. Other cardiovascular drugs include chronotropic drugs that can alter the heart rate. Epinephrine or adrenaline, norepinephrine, noradrenaline, and atropine increase the heart rate. Quinidine, Quinidex, procainamide, Pronestal, lidocaine, xylocaine, and propranolol slow the heart rate. Inotropic drugs alter the contractions of the myocardium. Digitalis and its derivatives, digoxin and digitoxin, increase the strength of contractions of the myocardium, thus leading to increased cardiac output. Dromotropic drugs affect the conduction speed of the atrioventricular node and subsequently the rate of conduction of electrical impulses in the heart. A calcium channel blocker such as verapamil slows the speed of conduction through the cardiac neural system and has a negative dromotropic effect. Anticoagulants reduce the susceptibility to thrombus formation. These include aspirin, warfarin or Coumadin, heparin, and low molecular weight heparin named dalteparin, Fragmin, and new thrombin inhibitors such as dabigatran, which is Pradaxa, and Xarelto. Streptokinase, which is a derivative from hemolytic streptococci, dissolves the fibrin in blood clots. It's administered intravenously within 3 to 4 hours of a heart attack caused by a clot. It can be effective in dissolving the clot. Tissue plasminogen activators bind strongly to fibrin and dissolves clots that have caused heart attacks. It's similar in effect and use to streptokinase. Retiplase or Retivase and urokinase, abokinase are forms of TPA. Beta blocker from our list of terms. Block is to obstruct. Beta, the second letter in the Greek alphabet. A beta adrenergic blocking agent used in the treatment of arrhythmias, hypertension, and other diseases. Chronotropic is affecting the heart rate. Chrono means time. Dromo, race, a running, affect the rate of conduction at the AV node and subsequently the heart rate. So chronotropic and dromotropic both affect heart rate. Diuretic, uret is urination or urine. So a diuretic is an agent that acts on the kidney to increase urine output. Inhibit is Latin to keep back. Inotropic, ino is sinew, tropic is change affecting the contractility of cardiac muscle. Statin is Latin for condition or state, a drug used to lower cholesterol in the bloodstream. Dermatologic drugs, okay, used for the treatment of the skin. No matter what the cause of skin lesions, a wide range of topical pharmacologic agents or different types can be used in their treatment, either to relieve symptoms or to cure the disease. Topical in its origin, or original Greek I should say, means pertaining to a specific place. It's used today to describe the pharmacological agents specifically on the skin or mucous membranes. Antipruritics, topical lotions, ointments, creams, or sprays that relieve itching. Corticosteroids such as hydrocortisone are used most frequently. Antibacterials, topical agents that eliminate the bacteria that cause epidermal infections. The antibiotic neomycin is frequently used in ointments for this purpose. Antifungals, topical agents that eliminate or inhibit the growth of fungi. Lamisil, mycostatin, Nilstat, used as a cream or ointment or as an oral drops for oral candidiasis. A class of drugs called imidazoles is available in many forms, including creams, sprays, lotions, and shampoos. They include chlorotrimazole, canesten, and clomazole, and ketoconazole, keptopine, and Dactogold. In oral preparations, amphotericin B fungizone is used to treat oral candidiasis, thrush, and in IV therapy it's used for systemic fungal infections. A recent study has shown that over-the-counter mentholated ointments such as Vicks VapoRub can be effective in treating toenail fungus infections. Parasiticides, topical agents that kill parasites living on the skin. Lindane is used in lotions or shampoos to kill lice if other methods have failed. Keratinolytics are topical agents that peel the skin stratum corneum away from other epidermal layers. Salicylic acid is used for this purpose as a keratolytic or exfoliating agent. It's used in the treatment of acne, psoriasis, ichthyosis, and dandruff. It's available in the form of wipes, creams, lotions, gels, ointments, shampoos, and patches in strengths varying from 3 to 20%. Anesthetics, topical agents that relieve pain or itching on the skin surface. Benzocaine, ethyl ester of para-aminobenzoic acid, is used for this purpose as a numbing cream. It's given prior to injections for infant teething or oral ulcers and for hemorrhoids. Retinoids are derivatives of retinoic acid, vitamin A, that are used in the treatment of acne, sunspots, and psoriasis. Retinoids are powerful drugs that are used only under the strict supervision of a physician. Tretinoin, Retin-A, is used topically for the treatment of acne. Isotretinoin, Accutane, is taken orally for the treatment of severe acne. Atretinate, Tegasone, is taken orally for the treatment of severe psoriasis. And adapalene, Differin, is used topically for the treatment of psoriasis. Cream comes from the Latin term thick juice, a semi-solid emulsion for topical use. Exfoliation, folate is leaf. Okay, exfoliation is detachment and shedding of superficial cells from any tissue surface. Exfoliation is the quality of exfoliation. Ichthyosis, ichthy is fish, scaling and dryness of the skin. Keratolytic, kerato means horn, light means loosening, causing separation or loosening of the horny layer, the stratum corneum of the epidermis. Lotion is Latin for a washing, a liquid suspension for topical use. Ointment is French for smearing, a semi-solid preparation for topical use. Endocrine drugs. Okay. Diabetes drugs, of course, being one of the most common endocrine diseases. Anti-diabetic drugs treat diabetes mellitus by lowering blood glucose levels. Diabetes mellitus type 1 is caused by a lack of insulin, is treated predominantly by subcutaneous injections of insulin. All insulin is sold in liquid form, but in different strengths. The most common strength prescribed in the U.S. is U100, which is 100 units of insulin per milliliter of liquid. 4 synthetic types of insulin are rapid-acting insulin, which begins to work in 5 to 10 minutes and peaks in about an hour and lasts 2 to 4 hours. Examples include Lispro, which is Humalog, and insulin aspart, which is Novolog. Regular acting insulin, which reaches the bloodstream within 30 minutes, peaks after 2 to 3 hours, and is effective for 2 to 3 hours. Examples include insulin isophane, Humulin R, and Novolin R. Intermediate acting insulin, which reaches the bloodstream after 2 to 4 hours, peaks 4 to 12 hours later, and is effective for 12 to 18 hours. Examples include isophane, which is Humulin N and Novolin N. Then long-acting insulin reaches the bloodstream after 6 to 10 hours and is effective for 20 to 24 hours. Examples include insulin glargine, which is Lantus, and insulin detamers, which is Levemir. Insulin pumps deliver rapid or regular-acting insulin continuously over a 24-hour period through a subcutaneous catheter. Buttons on the pump allow an additional bolus of insulin to be given if blood sugar levels become too high. Diabetes mellitus type 2 is caused by resistance of the body's cells to insulin. Several types of drugs, mostly given orally, can be effective in its treatment. They're often given in combination. Biguanides increase the uptake of glucose by body cells. Metformin or glucophage is a first-line medication for type 2. It can be used in combination with other oral diabetic medications, particularly rosiglitazone. It is the most widely prescribed anti-diabetic drug in the world. In the United States, more than 50 million prescriptions are written annually for its generic formulations. Thiazolidinediones, thiazolidinediones, also known as glitazones, enhance the use of glucose by the body. The two that are FDA approved are rosiglitazone, which is Avantia, and pioglitazone, which is Actos. However, rosiglitazone is currently being evaluated for potential adverse cardiac effects. Sulfonylureas stimulate insulin release from the pancreatic beta cells. Only effective in the treatment of type 2 diabetes, they can be used in combination with metformin or thiolidoiodines. First-generation agents include tolbutamine, which is Oronase, and chloropropamide, which is Diabenese. More effective second-generation agents include glipizide, which is Glucotrol, and glyburide, which is Micronase. Exenatidine, Byetta, is the first injectable or subcutaneous drug approved for type 2 diabetes. It's injected subcutaneously 60 minutes before the first and last meals of the day. It stimulates insulin production from the pancreatic beta cells. 3 oral drugs that stimulate insulin production have been approved for type 2 diabetes. Sitagliptin, which is Januvia, approved in 2006. Saxagliptin, Onglyza, 2009, and linagliptin, Tradjenta. These drugs are often used in combination with metformin. Okay, here's our word list. Biguanides, derived from the chemical name 2-carbinamidylguanidine, classes of drugs based upon the molecule used for the treatment of diabetes. Diabetes mellitus. Diabetes is Greek for siphon. Mellitus is the Latin for sweetened with honey. Metabolic syndrome caused by insulin deficiency and or insulin ineffectiveness. Insulin, insul is island, a hormone secreted from the islet cells of the pancreas. Sulfonylureas. Ano is nail, urea is urine, a group of chemicals related to sulfonamides that possess hypoglycemic action. And then finally, thiazolidinediones, derived from chemical names of the class member drugs, a class of anti-diabetic drugs that diminish peripheral insulin resistance. Hormone replacement therapy. Okay. AI, aromatase inhibitor. ERD, estrogen replacement downregulator. HRT, hormone replacement therapy. HT, hormone therapy. PTU, propylthiouracil. SCRM, SERM, selective estrogen receptor modulator. Hormone replacement therapy uses estrogen and progestin to treat symptoms of menopause. Hormone therapy, HT, comes as a tablet, patch, injection, vaginal cream, or vaginal ring. HRT protects against osteoporosis and reduces the risk for uterine cancer, but it may increase the risk for blood clots, breast cancer, heart disease, stroke, and gallstones. At this time, short-term, up to 5-year use of HRT given in the lowest possible dose to treat the symptoms of menopause appears to be safe for many women. Estrogen makes hormone receptor positive breast cancers grow. Hormone therapy medications treat hormone receptor positive breast cancers by lowering the amount of estrogen in the body and or blocking the action of estrogen or breast cancer cells. They're used after surgery to help slow the growth of advanced stage or metastatic hormone receptor positive breast cancers. There are 3 main types of HT agents. Aromatase inhibitors, which stop the production of estrogen from androgen in postmenopausal women. These medications are Arimidex, Arimocin, and Femara. Each is given in a pill form, taken once a day. Anastrozole and letrozole are available in generic form. Selective estrogen receptor modulators, which block estrogen in the estrogen receptors of breast cells so that the cells can't grow or multiply. SERMs are tamoxifen, Nolvadex, raloxifene, Avista, and toremifene, which is ferristone. And then estrogen receptor downregulators, ERDs, act just like SERMs, sitting in the receptors of breast cells to block estrogen. Fulvestrant, which is Falsodex, is the only approved ERD at this time. Thyroid drugs. Thyroid replacement is used to treat hypothyroidism and to suppress further growth of thyroid tissue in people with thyroid cancer. Levothyroxine, Levoxyl, Synthroid, Unithroid, which is identical to the thyroid hormone T4, is the most commonly prescribed form of thyroid replacement. It's taken orally once a day. Antithyroid drugs are used to treat overactive thyroid gland, hyperthyroidism, by decreasing its output of the thyroid hormone. Propylthiouracil blocks the production of thyroid hormones inside the gland. Methimazole, Tapazole acts the same as PTU. Both drugs take 1 to 4 months to normalize thyroid levels. Beta blockers can help block the body's cells' reaction to excess thyroid hormone in iodide solutions. Lugol solution can prevent the release of thyroid hormone from an overactive thyroid gland. Radioactive iodine, a radioactive isotope, is used to kill both normal and cancerous thyroid cells in hyperthyroidism and thyroid cancer. Adrenal drugs. People with adrenal insufficiency have a shortage of the hormones cortisol and aldosterone. To treat the condition, cortisol is replaced with a synthetic glucocorticoid such as hydrocortisone, which is hydrocortisone or Cortef. prednisone, which is a generic, or dexamethasone, which is Decadron. Aldosterone is replaced with a synthetic mineralocorticoid, fluodocortisone acetate, Florinef. Overproduction of the two hormones is usually caused by tumors of different types that are removed surgically. Okay, in our word bank, glucocorticoid, cortic means cortex or cortisone, gluco means glucose, hormone of the adrenal cortex that regulates glucose metabolism. Isotope, tope is part, radioactive element used in diagnostic procedures. Mineralocorticoid, mineral is inorganic materials. Cortic, cortex or cortisone, hormone of the adrenal cortex that influences sodium and potassium metabolism. And then radioactive, radio means radiation, act is performance, the property of emitting alpha, beta, or gamma rays. Gastrointestinal drugs. Antacids are taken orally, neutralize gastric acid and relieve heartburn and acid indigestion. Examples of antacids include aluminum hydroxide and magnesium hydroxide, Maalox and Mylanta. Magnesium hydroxide, milk of magnesia. Calcium carbonate, Tums or Rolaids. Histamine 2 receptor antagonists, H2 blockers, block signals that tell the stomach cells to produce acid. They're used to treat gastroesophageal reflux and esophagitis. Examples include cimetidine, which is Tagamet, famotidine, which is Pepcid, ranitidine, which is Zantac, and nizatidine, which is Axid. Less potent over-the-counter variants of these drugs are also available. Proton pump inhibitors suppress gastric acid secretion in the lining of the stomach by blocking the secretion of gastric acid from the cells into the lumen of the stomach. Examples include omeprazole, which is Prilosec, lansoprazole, which is Prevacid, and esomeprazole, which is Nexium. Esomeprazole, I should say. A new form of PPI called imidazopyridine, tenantoprazole, appears to be extremely effective in reducing gastric acid. Misoprostol, Cytotec, inhibits the secretion of gastric acid and is approved for the prevention of non-steroidal anti-inflammatory drug-induced gastric acid. Sucralfate, which is Carafate, reacts with gastric acid, hydrogen chloride, to form a paste that binds to stomach mucosal cells and inhibits the diffusion of acid into the stomach lumen. It also forms a protective barrier on the surface of an ulcer. It's mainly used in the prophylaxis of stress ulcers. Anti-H. pylori therapy for the treatment of peptic ulcer and chronic gastritis is given with a combination of two antibiotics, for example, amoxicillin and clarithromycin, and a proton pump inhibitor. Antiemetics, drugs that are effective against vomiting and nausea, are used to treat motion sickness and the side effects of opioid analgesics, general anesthetics, and chemotherapy. The types of antiemetics include serotonin antagonists, which block serotonin receptors in the CNS and GI tract. They're used to treat postoperative and chemotherapy nausea and vomiting. Examples include dolasterone, Enzamet, granisetrone, which is Kytril, and ondansetrone, which is Zofran. Dopamine antagonists, which act in the brain. They are inexpensive but have an extensive side effect profile and have been replaced by serotonin antagonists. Examples include chlorameprazine, which is Thorazine, and prochloroperazine, which is Compazine. Antihistamines, which are used to treat motion sickness, morning sickness in pregnancy, and opioid nausea. Examples include diphenhydramine, Benadryl, and promethazine, which is Phenergan. cannabinoids, which are used in patients with cachexia who are unresponsive to other antiemetics. Examples include cannabis, medical marijuana, and dronabinol, which is Marinol. Laxatives that are used to treat chronic constipation. If increased water and fiber is unsuccessful, over-the-counter forms of magnesium hydroxide are the first agents to be used. Lubiprostone Resollar has received FDA approval. It acts on the epithelial cells of the GI tract to produce a chloride-rich fluid that softens the stool and increases bowel motility. Antidiarrheal drugs are widely available over the counter. Examples include loperidine, which is Imodium and AD and Maalox, which reduces bowel motility, bismuth, subsalicylate, Pepto-Bismol, which decreases the secretion of fluid into the intestine, adipulgite is kaopectate, which pulls diarrhea-causing substances away from the GI tract, as well as enzymes and nutrients. A combination of diphenyl oxalate and atropine, Lamodal, a Schedule 5 drug, reduces bowel motility. Cachexia. Eczia is condition of the body, a general weight loss and wasting of the body. Diffusion, diffuse is movement, process by which small particles move between tissues. Laxative, laxa means looseness, an oral agent that promotes the expulsion of feces. Motility, mot is to move, the ability for spontaneous movement. Okay. Stool is an Old English for seat, the matter discharged in one movement of the bowels. Musculoskeletal drugs. COX is cyclooxygenase enzymes. NSAIDs inhibit the two COX enzymes that are involved in producing the inflammatory process. They have analgesic and antipyretic effects, and are used for treatment of tissue injury, pyrexia, rheumatoid arthritis, osteoarthritis, gout, nonspecific joint and tissue pains. The three major NSAIDs, each of which is available over the counter, are acetylsalicylic acid, ASA, which is aspirin, which in addition to the above effects and uses also has an antiplatelet effect due to its inhibition of one of the COX enzymes, thus it's often used in the prevention of heart attacks. Ibuprofen, Advil, Motrin, and several other trade names, which acts by inhibiting both the COX enzymes, essential elements in the enzyme pathways involved in pain, inflammation, and fever. It's taken orally, but in 2009, an injectable form of ibuprofen, Caldolor, was approved for use. In some studies, ibuprofen has been associated with the prevention of Alzheimer and Parkinson's disease, but further studies are needed. Naproxen, Aleve, and many other trade names, which is taken orally once a day, also inhibits both COX enzymes. Indomethacin is an NSAID that inhibits both COX enzymes. It's a potent drug with many side effects. It's not been used as an analgesic for minor. It is not used as an analgesic for minor aches and pains or for fever. Paracetamol, which is acetaminophen, an active metabolite of phenacetin, not an NSAID, is a widely used over-the-counter analgesic and antipyretic. It's used for the relief of minor aches and pains and is an ingredient in many cold and flu remedies. Okay, of course, acetaminophen is Tylenol. Skeletal muscle relaxants are FDA approved for spasticity, baclofen, dantrolene, tizanidine, or for musculoskeletal conditions like multiple sclerosis, carisoprodol, chlorzoxazone, cyclobenzaprine, metaxalone, methocarbamol, or phenadrine. The only drug with available evidence for efficacy in spasticity is tizanidine, Xanaflex, Ceridalude, but cyclobenzaprine Amarix appears to be somewhat effective. Okay, these are our words. Analgesia or analgesic. Gese is sensation of pain. So analgesia, state in which pain is reduced, and analgesic is an agent that produces analgesia. Antipyretic, pyrete means fever, so an agent that reduces fever. Ingredient is going, an element in a mixture. Metabolism, metabolite, metabol is change, the constantly changing physical and chemical processes in the cell. Okay, metabolite is any product of metabolism. Neurologic drugs. The transmission of from one neuron to another and from a neuron to a cell is achieved by neurotransmitters at synaptic connections. Drugs that affect the nervous system include opioids, which depress nerve transmission in the synapses of sensory pathways of the brain and spinal cord. They also bind to opioid receptors found principally in the central and peripheral nervous system and in the GI tract. There are a number of broad classes of opioids. Natural opiates are alkaloids contained in the resin of the opium poppy, primarily morphine and codeine. Semi-synthetic opioids, which are created from the natural opiates, include heroin, hydromorphone, Dilaudid, hydrocodone, Vicodin, oxycodone, Dinacron, and buprenorphine, Subutex. Fully synthetic opioids include fentanyl, sublimage, pethidine, which is Demerol, and methadone, which is Cimarron. Natural opioid peptides are produced naturally in the body. They include endorphins, enkephalins, and endomorphins. Indications for opioids are moderate to severe pain, cough, severe diarrhea, anxiety due to shortness of breath, and opioid dependence, in which case methadone and buprenorphine are used. Opiates are addictive because they produce tolerance and physical dependence. Our keynotes: an opiate is any preparation or derivative of morphine. An opioid is a narcotic substance, either natural or synthetic. A narcotic substance is any drug, natural or synthetic, with effects similar to those of opium and opium derivatives. Opiate antagonists, such as naloxone, Narcan, and naltrexone, Revia, which prevent opiates from acting in the synapses. They can be used in cases of drug overdose and to help recovering heroin addicts stay drug-free. Analgesics, which are drugs to relieve pain. The major classes are NSAIDs and paracetamol, which is acetaminophen, and we talked about these earlier. Opiates, combination of the two previous classes. Examples of these include prescription drugs, which includes acetaminophen with hydrocodone, Annexia, and acetaminophen with oxycodone, Percocet. Triptans, which are effective serotonin receptor agonists in the treatment of migraines and cluster headaches that do not respond to NSAIDs. They do not provide preventative treatment and are not a cure. Some 17 brand names of triptans are available. Inhaled anesthetics such as isoflurane, which act similarly to but are more powerful than sedatives. However, they are being replaced by IV agents such as propofol, which is Diprivan. Anti-epileptics, which act in different ways on the synaptic junctions to keep stimuli from passing across the synapse. Phenobarbital, Phenytoin, Dilantin, and carbamazepine, Celispin are examples. Alzheimer's drugs, which cannot reverse the disease process nor stop the underlying destruction of nerve cells. Only two types of drugs are approved. Cholinesterase inhibitors boost the amount of acetylcholine available at the synapse. 3 cholinesterase inhibitors are available. Aricept, donepezil, is approved for all stages of Alzheimer's disease. Galantamine, which is Razidine, is approved for mild to moderate Alzheimer's disease. Rivastigmine, Exelon, is approved for mild to moderate Alzheimer's disease. Memantidine, Namenda, which regulates a different messenger chemical at the synapse, is approved for moderate to severe Alzheimer's disease. All of these drugs are only modestly effective in reducing the rate of cognitive decline. Multiple sclerosis drugs are used to treat remissions, are restricted to corticosteroids, which reduce the inflammation that occurs during a relapse. Drugs that attempt to modify the course of the disease include beta interferons, Avonex, beta-seron, Extavia, Rebif, Gladaramir, Copaxone, Fingolimide, Gynenya, and Natilzumab. Of the four types, beta interferons are used most frequently. Narcotic. Narco means sleep or stupor. Drug derived from opium or opium-like compounds having similar effects. Opiate or opioid, Latin for bringing sleep, a drug derived from opium, and narcotic substance, either natural or synthetic. Relapse, lapse is to slide back, return of the disease manifestations after an interval of movement. Remission, miss is to send, a period where there is lessening of the manifestations of a disease. Psychiatric drugs. Antidepressants will increase the amount of serotonin at the synapses, where serotonin is a neurotransmitter. Sertraline, hydrochloride, Zoloft, paroxetine, Paxil, and fluoxetine, Prozac are examples. Stimulants such as caffeine, nicotine, amphetamines, dexedrine, Adderall, Ritalin, and cocaine enhance stimulation provided by the sympathetic nervous system. They cause the level of dopamine to rise in the synapses, leading to the pleasurable effects associated with these drugs. Sedatives such as barbiturates and benzodiazepines decrease the sensitivity of the postsynaptic neurons and quiet nervous excitement. They also act on sleep centers to induce sleep and treat insomnia. Newer sedative hypnotics such as zolpidem, Ambien, zaleplone, which is Sonata, and S-zolpiclone, Lunesta, act on gamma aminobutyric acid receptors. Ramiltion Rosarim is a selective melatonin receptor agonist. Tranquilizers such as chlorpromazine, thorazine, haloperidol, alloperidine, and the benzodiazepines, Librium, Valium, Xanax, calm like sedatives but without including a sleep-inducing effect. Mood stabilizers, which focus on diminishing manic episodes, include lithium carbonate, carbolith, and carbamazepine, Tegretol. Antipsychotics are used to treat symptoms of psychosis, including schizophrenia. Chlorpromazine, thorazine, haloperidol, Haldol, and trifluoperazine, Stelazine are examples. Psychedelics distort sensory perceptions, particularly sight and sound. They may be natural plant products such as mescaline, psilocybin, and dimethyltryptamine, or they can be synthetic such as lysergic acid diethylthylamide, LSD. Methylene dioxymethamphetamine, MDMA or ecstasy, and phencyclidine or PCP or angel dust. They increase the amount of serotonin in the synaptic junctions, and some deliver additional amphetamine stimulation. Marijuana has the active ingredient tetrahydrocannabinol, THC. It produces sedative like drowsiness like alcohol, dulls pain like opiates, and in high doses distorts perception like psychedelics. Unlike opiates or sedatives, tolerance does not occur. Sedative, sedat, means to calm, agent that calms nervous excitement. Stabilize or stabilizer, stabil is steady or fixed, to make or hold firm and steady. Stimulant, stimule is to excite or strengthen, agent that excites or strengthens functional activity. Tranquilizer, tranquil, means calm or serene. Whoops. Immunosuppressive drugs. Immunosuppressive drugs are agents that inhibit or prevent activity of the immune system. They're used to prevent the rejection of transplanted organs and tissues, treat autoimmune diseases such as rheumatoid arthritis, multiple sclerosis, systemic lupus erythematosus, and ulcerative colitis. Attempts to control non-immune diseases such as long-term asthma. They're classified in 4 groups: glucocorticoids, cytostatics, antibodies, and targeted immune modulators. Glucocorticoids influence all types of immunological inflammatory responses, no matter what their cause. Examples include hydrocortisone and prednisone. Cytostatics inhibit cell division. Examples include cyclophosphamide, which is cytoxin, which is probably the most potent immunosuppressive agent. Methotrexate, which is imethopterin. Azathioprine, which is generic. Cyclosporine, which is cyclosporin A. Mechlorothiamine, nitrogen mustard, and the antibiotic actinomycin D, which is used in kidney transplantation. Antibodies are used as immunosuppressant therapy to prevent acute rejection of transplants. Monoclonal antibodies are directed towards specific antigens and are used to prevent the rejection of transplanted organs. Examples include bevacizumab and panitumumab for cancer, infliximab and adalimumab for autoimmune diseases such as rheumatoid arthritis, and basiliximab and daclizumab for preventing the rejection of kidney transplants. Targeted immune modulators are a new category of drugs used to treat diseases such as rheumatoid arthritis, ankylosing spondylitis, and psoriatic arthritis. Evidence of their effectiveness is evolving but not yet conclusive. Chemotherapy drugs. Chemotherapy is the treatment of cancer with anti-neoplastic drugs, which kill the rapidly dividing cancer cells. Unfortunately, this means that chemotherapy also harms normal cells that divide rapidly, such as those in the bone marrow, digestive tract, and hair follicles. As a result, chemotherapy commonly has side effects, such as decreased production of blood cells, nausea and vomiting, and alopecia. Chemotherapy is often combined with other treatments such as surgery and radiation. The types of chemotherapeutic agents include alkaloids such as vincristine, oncovin, and vinblastine, DNA modifiers such as cyclophosphamide, cytosane, and chlorambucil, which is leucoran, and cytotoxic inhibitors such as actinomycin, generic. Anti-neoplastic, okay, it has 2 prefixes in this case. Plast is to form. Anti is the prefix that means against. Neo means new, and ic is pertaining to. Anti-neoplastic, pertaining to the preventing or forming of, pertaining to preventing the forming or spread of cancer cells. Cytostatic is inhibiting cell division. Cyte is cell. Stat means to stand still. Cytotoxic is destructive to cells. Modulator, module means measure properly, agent that regulates or adjusts. Monoclonal, clone means cutting or used for propagation. Respiratory drugs. Bronchodilators. Relax the smooth muscles of the bronchioles. Bronchodilation examples are theophylline and aminophylline. Theophylline plus ethylene diamine, taken orally but used rarely these days. Beta-2 agonists such as albuterol, Proventil, metoprolol, Alupent, and formoterol, which is Foradil, and salmeterol, which is Ceravent, which are inhaled, and anticholinergics such as ipratropium, Atrovent, which is inhaled, and tiotropium, Spiriva, which is taken orally. Newer groups of bronchodilators are leukotriene inhibitors, montelukast, Singulair, zafirlukast, Accolate, and xylitone, Zyflow, which are taken orally, and mast cell stabilizers, chromium sodium, Intal, and nitochromyl Tylade, which are inhaled. Anti-inflammatory drugs such as corticosteroids are given by inhalation. For example, beclomethasone, which is Vanseril, Beclovent, budesonide, which is Pulmicort, fluticasone, which is Flovent, and triamcinolone, which is Asmacort. They can be used orally or intravenously in acute episodes of asthma or chronic obstructive pulmonary disease. Combinations of drugs are frequently used. For example, beta-2 agonist plus anticholinergic, albuterol plus ipratropium, Combivent, inhaled corticosteroid plus a beta-2 agonist, budesonide plus formoterol, Symbicort, and fluticasone plus salmeterol, Advair. An oral leukotriene inhibitor is often taken in association with an inhaled corticosteroid to reduce the dose of corticosteroids. Mucolytics are agents that break up mucus to allow it to be cleared more effectively from the airways. Examples are guaifenesin, common in over-the-counter cough medications, and N-acetylcysteine, Mucomyst, taken through a nebulizer. Antibiotics are used when bacterial infection is present in COPD, penicillin, erythromycin, cefotaxime, clavulan, and flucloxacin. Fluoxetine are frequently used. Oxygen is used in hypoxia and can be given by nasal cannula or by mask and intubation. Patients with severe chronic COPD can be attached to a portable oxygen cylinder. Cannula is Latin for reed, tube inserted into a blood vessel or cavity as a channel or for fluid or gas. Inhalation, hale is breathe, the act of inspiration. Instrument for administering medications by inhalation. Mucolytic, muco is mucus, lit is to dissolve, agent capable of dissolving or liquefying mucus. Nebulizer, nebule is cloud. Urologic drugs, renal drugs, AIDS, acquired immunodeficiency syndrome, heart, highly active antiretroviral therapy, HIV, human immunodeficiency virus, HPV, human papillomavirus, PID, pelvic inflammatory disease, STD, sexually transmitted disease, UTI, urinary tract infection. Pyelonephritis, which is inflammation of the pelvis of the kidney, usually spreading from a urinary tract infection, is treated aggressively with antibiotics such as aminoglycoside, gentamicin, together with ampicillin or ceftriaxone, Rocephin. Necrotic syndrome is treated initially with corticosteroids, prednisolone, and cytostatic drugs such as cyclophosphamide, cytoxan, and cyclosporin. Cyclosporin A are used for relapses. Renal cell carcinoma is treated surgically with radical nephrectomy. As renal cell carcinoma is resistant to both radiation and chemotherapy, metastases are treated with targeted therapies using drugs such as temsirolimus, Torcel, and bevacizumab, Avastin. Despite these drugs, the overall survival rate has not improved much. Renal stones can be prevented by alkalinization of the urine with acetazolamide, Diamox, and with diazide diuretics such as chlorthalidone, which is thalatone. Renal transplant patients receive a regimen of drugs to prevent rejection. The most common regimen is a cocktail of tacrolimus, Prograf, mycophenolate, Cellcept, and prednisone, which is generic. In patients with chronic renal disease and diminished renal function, dosing of renally excreted drugs should be adjusted by reducing the dose, increasing the dosing interval, or both. Drugs that have to be adjusted include antihypertensive agents, hypoglycemic agents, antimicrobials, analgesics, NSAIDs, and many herbal products. Non-renal urinary tract infection drugs, UTIs, including cystitis, are treated with antibiotics. UTIs, including cystitis, are treated with antibiotics such as trimethoprim, Trimpex or Primsol, nitrofurantoin, which is furandantin, macrobid, or one of the many cephalosporins. Infections that spread from the urinary tract to the epididymitis, and the testes or chitis are treated with cephalexin or ciprofloxacin. Sexually transmitted diseases are caused by a variety of organisms in men and women. They require different treatments depending on the organism. Chlamydia is treated with a single dose of azithromycin, Zithromax, and others, or a week of doxycycline, Vibramycin, and others in both sexes. Trichomoniasis is treated with metronidazole, Flagyl, or Tindamax. Gonorrhea has become resistant to most classes of antibiotics except cephalosporins such as ceftriaxone, Rocephin, and cefixime, Suprax. Bacterial vaginosis is treated with metronidazole, Flagyl, or clindamycin, Cleocin. Pelvic inflammatory disease is usually a complication of chlamydia or gonorrhea, is treated with antibiotic combinations of two drugs. For example, cefotetan, cefotan, and doxycycline, Vibramycin, clindamycin, Cleocin, and gentamicin, garamycin, or cefoxtin, cefotan, and doxycycline, Vibramycin. Genital herpes infections have no cure, but antiviral medications such as acyclovir, Zovirax, Famocyclovir, Famvir, and valacyclovir, Valtrex, can prevent or cut short outbreaks. Syphilis in its early stages requires a single dose of IM intramuscular penicillin. If the infection has been present for more than a year, additional doses are required. Human papillomavirus has 40 different types that infect the genital area. HPV can cause cervical cancer. There is no known treatment, but 2 vaccines are approved by the FDA. Cervarix protects against HPV type 16 and 18. Gardasil protects against type 6, 11, 16, and 18. Both protect against HPV types that cause 70% of cervical cancers, and Gardasil protects against HPV types that cause 90% of genital warts. Human immunodeficiency virus infections have no cure. The aim of treatment is to maintain a good quality of life and prevent the development of acquired immunodeficiency syndrome. Highly active antiretroviral therapy is a combination of at least 3 drugs belonging to at least 2 types of antiretroviral agents. Without heart, HIV infection progresses to AIDS in approximately 9 to 10 years. Antiretroviral, retro means back or backward, vir means virus. So antiretrovirus is an agent that inhibits or kills any virus of the family. Retrovirus is a virus with RNA core genetic material. Genital or genitalia. Genit is primary male or female sex organs. So genital related to the male or female sex organs. Genitalia, external and internal organs of reproduction. Vaginosis and vaginitis. Vagin means vagina. Osis is condition. Any disease of the vagina. Vaginitis is inflammation of the vagina. All right, and so that is our chapter on pharmacology.